Okay. Good morning, everybody. I am Laura Shaughnessy, and I serve as the chairperson of the Professional Counseling Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. I ask members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic medium. Leslie Suister.
Here.
Thank you. Kenneth Huey.
Here.
Thank you. Bob Kircher.
Here.
Ken Olaf.
Here.
Here. Gary Price.
Here.
Elaine Patachik.
Here.
Right, and we know that Andrew Secor will not be present. I also note the following staff members are present: David Fye and Leslie Allen.
Here.
Here.
Thank you. Next, David Fye will read a message concerning this meeting being held remotely.
Thank you, Laura. And actually, Sammy Barksdale is also present and is available in case there's anything that's needed from her. So she's also in.
Thank you.
This is Dave Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about its concern. Open Meeting Act, or COMA, does not require the advisory committee to provide public comment or answer questions from individuals. However, individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at the meeting today, as no individuals requested to provide public comment. Because we are conducting this meeting remotely by conference call and other teleconference ability, I state for the record the following information. The meeting is being conducted remotely. However, access to the meeting is being conducted with a medium of interactive communication that allows the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of COMA are not suspended. As such, we'll be conducting the meeting pursuant to COMA. On May 5th, 2021, we sent notice of the advisory committee meeting to all individuals who had requested notice of the advisory committee meeting. The notice was also posted on the board's website at bsrb.ks.gov, and you may obtain a copy of the notice at that website. An agenda and other media material for the meeting will be posted on the board's website on the day of the meeting. Request a copy of the agenda by sending an email to david.fye@ks.gov with the subject line "request for the agenda," and it will be sent.
I think I'm muted.
And Elaine, I think I'm picking up a little bit of background noise. So I just wanted to let you know about that.
Oh, I need to turn my deal on mute.
There you go.
Thank you. The notice that's posted on the board's website contains information for the conference call and the YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if there are any technical issues during the meeting, you may call the board's office at 785-296-3240. A recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting, and that can be accessed by using the link on the meeting for the meeting on the agenda.
Great, thank you. The meeting is now called to order, and the advisory committee will begin its discussion of the first item on its agenda. So the first thing we have is agenda approval and any addition of new business. Does anybody have any new business they'd like to bring? Okay, if you have any in the future, don't hesitate to email me, email David, and we will be sure to add those items to the agenda. So let's do agenda approval of the last meeting, June 7th, 2021. Any questions about the meeting notes? Okay, I need a motion. Does anyone make a motion to approve the meeting notes?
I move approval as distributed.
I second.
Thank you, Gary. Thank you, Elaine. All those in favor? Aye.
Aye. Aye.
Aye.
Any opposed?
I will abstain since I wasn't at the meeting, so I shouldn't vote. So
Kenton Olaf is abstaining. Thank you, Kenton. Okay, so the minutes are approved for June 7, 2021. Thank you. Okay, Executive Director's report. David.
Thank you. So the first thing I wanted to note is that at the last board meeting, which we had back in July, the board elected a new chair and a new vice chair. And the new chair of the BSRB is Leslie Seawester. So I wanted to congratulate her on that. The new vice chair for the board is Dave Anderson. And we also wanted to thank the outgoing chair, Deb Stidham. She has served as chair for the board, and she will continue to serve as a board member, but she is just stepping down from her position as chair. So I wanted to thank her for her service to the board as well. Another item I wanted to make you all aware of. So over the last couple of years now, we've been dealing with a lot of the issues related to the COVID-19 pandemic. The last time that we spoke, there were some plans to have members of the office return to the BSRB office, and there were some executive orders that had gone in combination with some of the states of emergency and extensions of that. As of the middle of June, the official state of emergency in the state of Kansas related to the pandemic has ended, and an office employees did return to the BSRB office as of June 14th. However, recently there's been an uptick in the number of COVID-19 cases, some concerns due to the variants. And so the governor did go ahead and reinstitute some of the conditions that were in place during a lot of the pandemic. The new direction that we received as of last week is that starting today in state buildings, the state employees, whether they're vaccinated or not, are asked to start wearing the mask again for about the last month and a half. Anyone who was vaccinated did no longer had to wear the mask or social distance, but that changed as of today. And so we are now having anyone who enters the state building wear a mask, and then in public areas when you're walking around wearing masks and different things like that. So I want to let you know about that change, and we'll continue to monitor things due to health and safety conditions and let you kind of know how things are going. But as of right now, there's been no direction to have staff return to working from home. So we'll just be working in the office with some additional health and safety precautions. One of the other items I wanted to make you aware of is as the end of June passed, we completed fiscal year 2021. And one of my roles as executive director for the agency is in charge of the budget. And so we wrapped up one fiscal year and we started another fiscal year. So some of my time recently has been on completing end of the year fiscal reports. I gave the board an update on finances for the agency at the last board meeting to keep it at a very high level of summary. Overall, revenues came in just slightly above what they had been estimated for fiscal year 2021. They did fluctuate quite a bit month to month. As you recall, for most of 2021, there were executive orders that postponed the enforcement of the expiration of the licenses. However, that did end at the end of May or May 28th. So essentially we received less revenue throughout most of the year, but there was a big push at the end of the year for people to come under compliance. And so revenues were slightly above. Expenditures were below by about $50,000 to $100,000 below what was previously estimated to be spent. Some of that was savings related to the pandemic, and also some of the money that's in the budget is there in case certain cases go to a certain level of hearing, and some of the cost in case there's needed to be expert witnesses and other things like that. So if that wasn't needed to be spent, it just stayed in the fee fund. So overall, the balance in the fund is a little under $2 million. Expenditures are higher than revenue, and that's somewhat by design because the board a couple of years ago dropped a lot of the licensure fees. The good news is that based on the level of expenditures and revenue, it looks like what had previously been hoped to draw down the ending balance of the fund over time, looks like it's still on track for that to happen. So there's no real concerns at the moment about a decrease in revenue related to the pandemic. Another item is about once a year, the board generally has an offsite meeting for planning purposes. It tends to be a 1-day meeting or maybe a 2-day meeting to take a lot of different topics the board has been discussing and to kind of work on future planning and have a more in-depth discussion. That is tentatively scheduled for the end of September 26th and September 27th. We had originally planned to have that board member offsite meeting or retreat in Olathe, and we are still hopeful that that can occur. We're just going to continue to monitor health and safety conditions. And then we're exploring some other possibilities. If we're unable to go ahead and do it then, we're looking at some other possibilities to allow the board to meet and have those in-depth conversations. Another item I wanted to make you all aware of is we spent time earlier this year talking about the BSRB bill, and that did have a lot of effects for licensees. There was another bill that we have provided a few updates on, and that was House Bill 2066. House Bill 2066 expedited the time frame for processing licensure applications for certain reciprocity applications for military members, military spouses, individuals intending to reside in Kansas, or those who have already have residence here in Kansas. And so to implement some of the provisions of that bill, we worked with our online license database team with the Board of Healing Arts. Leslie modified a number of the applications. So we are tracking and providing information on some of the different provisions to get reciprocity under the conditions of that bill. So we're still working on that and trying to work out any issues related to that. And then the last item I wanted to update you on is that later this week, I will be out of the office for a few days. NBCC is putting on an annual Counseling Regulatory Board Summit. And so I will be attending that in Denver, Colorado. Some of the topics to be covered include board operations, information on professional counseling exams, disciplinary hearings, COVID-19 regulatory responses, counseling compacts, especially multi-state compacts, and other items. So I will be available, but probably won't be as accessible as I would be in the office. But I'll try to check in at least at the end of the day to kind of see if there's any urgent matters. But if you try to get a hold of me for the next few days, it may not have to be until I come back from that summit. So if you have any questions on any of those items, I'd be happy to answer any questions.
Any questions? Okay, thank you, David.
Thank you.
Thank you. Okay, so the first item to discuss is membership and recruitment for the advisory committee. So what we know is in our governance document, there's not a rule about how many members we can have, but typically we shoot for about 10 members. We have 6. So the goal would be to add about 4. We sent out, I shouldn't say we, staff sent out a letter asking for anybody to nominate, send it out to everybody, all the LPCs in the state. And David, how many did you say you received? Was it 16?
We got 16 different responses from individuals seeking to serve on the advisory committee.
Okay. So go ahead and talk about the process, if you would, David, that you expect us to go through.
Sure. Okay. So the advisory committee is just a little bit of background. The advisory committees assist the work of the board, and there's a different advisory committee for each of the professions. And the advisory committee makeup really isn't something that's discussed in statute, but there is the board governance document, like Laura referenced, from 2011, which notes some different processes for the advisory committee and expectations and certain things as far as membership. So one of the things that the advisory committees are noted for is that they have a length of service and that is limited. You can serve on an advisory committee up to 4 2-year terms. So you could serve a total of 8 years on the advisory committees. And so one thing that we did in reviewing some of the terms in the advisory, that document, is we went back and we looked at the length of service from the different members of the Professional Counseling Advisory Committee. And I'll go ahead and I'll share my screen. I have a document here with some of the length of service for the current members of the Professional Counseling Advisory Committee. Okay. So can you see my screen now?
Yes.
Okay. So Leslie went ahead, Leslie Allen, and pulled the length of service for the non-board members. So the board governance policy indicates that advisory committees will be made up of a member of the profession who is licensed in that discipline, and then also that there will be a public member of the board, and then it indicates that there will be no fewer than 3 other non-board members on the advisory committee. And as Laura mentioned, there's no maximum number. I think traditionally it's been discussed that the non-board members were traditionally limited to about 10. And for most of the advisory committees, that would sort of match the size of the board of 12 members, a professional member, a public member, and then no more than 10 other members. And as I mentioned, the length of service in the board governance policy document was to serve no more than 4 two-year terms. So the document you see before you is the length of service for the members of the advisory committee. And as you can see here, there are a few members who are right up on the 8 years of service or a little over. And then Kenton is about a year away from that. And so we had not pulled these numbers in a little while, but we wanted to kind of show you where individuals are at in terms of the advisory committee membership. And so that is one of the reasons why we went ahead and sent that information out to allow any members of the professional counseling profession go ahead and nominate themselves for consideration. But yeah, one item for the advisory committee to discuss is how big you would prefer for the advisory committee to be. I can tell you for comparison, comparing to the other advisory committees, the non-board members, that number tends to be between 5 and 7, but that doesn't mean that it has to be within that range. It probably would be best to, I would say, go by the tradition of having no more than the 10 members, but that is something that you could go ahead and discuss. As with board members, in the past, when advisory committee members have been replaced, generally advisory committee members have served until a new person came on board. That's kind of what's happened in the board as well. And so that's just kind of the tradition. So I want to make you aware of that. And let me just walk through a couple other items related to the advisory committees. I'll go ahead and stop sharing my screen now. So first, through the board governance documents, the person who has the ultimate authority to add members to the advisory committees and remove members of the advisory committees is the chair of the BSRB. And so the board governance document, it does say that the chair of the BSRB appoints members of the advisory committee and can remove members. And what it talks about in terms of the role of the advisory committee is it says that the advisory committees, so it says the advisory committees will receive the nominations of individuals who wish to serve on the advisory committees, and then they will review those nominees. And then in reviewing the nominees, the committee should work to ensure that there is representation based on geographical, gender, and public versus private settings. And then the committee of the whole discusses the nominations. And the chairperson of the committee will submit the names of the nominees to the BSRB board chairperson at the board meeting. And then the chairperson will review the nominations and may request input before making a decision, which will be announced at the next board meeting. So one thing that's a little tricky is that in the language of the board governance document, it uses the word nominees quite a few times. It's been my understanding that the tradition has been that the advisory committees receive all the list of nominees and then have discussions in a public meeting like this. And then according to the governance document, look for representation based on geographical, gender, and public versus private settings. And then some of the other advisory committees have indicated some additional items that they are hoping to get in the realm of diversity and more of a blend of people from different professions or different areas of the professions. But ultimately, based on what I understand, the tradition has been is that once the advisory committee reviews the applicants and then discusses them, they make recommendations. And so what I think would be the best would probably be if you were open to this as a committee, I would recommend scheduling another meeting, perhaps in a month before the board meeting. And then after today's meeting, what I could do is I could send the resumes and cover letters of the 16 individuals to each of you to review. And then you could come into that meeting in about a month, ready to discuss and make recommendations on those individuals for potential consideration for the advisory committee. And then once you had reached your recommendations as an advisory committee, you would forward your recommendations with the list of other nominees to the chair of the BSRB for consideration. And then as it said in here in the board governance document, the chair of the BSRB could request input before making a decision. And that would probably be for the chair of the BSRB to speak with the chair of the advisory committee to clarify or could look into any other matters. So that's my interpretation in trying to read through the board governance document and also ask some additional questions based on tradition given the fact that the board governance document was last approved about 10 years ago.
Thank you.
I
Does anybody
had a
have?
question, David, and I know we talked about this, the process and all of that, or that you just went over. Is there any streamlining that the staff goes through with those applications? Is there ever a time where there's someone who is an applicant submitted their application and they do not meet any of the maybe requirements or qualifications for being on the board, where those would be weeded out, or does the board or does the committee just get all of them and then the committee makes that decision?
Well, so I can tell you, so social work is a little unique because there were about 29 nominees for the social work advisory committee. Most of the other advisory committees tended to be about 5 to 6. And so one thing that most of those, and just let you know, you're the first advisory committee to discuss these nominees in this process. But for some of the ones who had about 5 or 6, sometimes they're putting those into sort of a table, which lists sort of some information without having to go too deep into the resumes and the cover letters. So one thing that I have been doing for the other advisory committees is I've been looking into each of the individuals who submits materials to verify that they are currently licensed by the BSRB. And so that is the check that I've been doing to make sure that they're licensed in whichever profession they applied for the advisory committee. But that's really the only check that I have done before sending those materials.
Thank you.
David, are
Well-
any of the other committees talking about something like a rubric so that the candidates can be scored or rated based on meeting the criteria that we value?
I haven't heard anything about a scoring system. The board governance document does point to a few factors to be considered, but I don't think that's necessarily the only factors that could or should be considered. It talks about ensuring representation based on geographical, gender, and public versus private distribution. But I know that there are some other advisory committees that are looking into other topics as well. But in terms of having sort of a system to score individuals, I haven't heard any discussions about that yet.
Okay. So
Well,
one thing. No, go
I'm
ahead.
sorry. One
This
thing I
is
just
Elaine, and I would really like to see some professional involvement in the organizations. And I don't know if you can do that, but to really build your knowledge about licensing and everything involved, I think that's something that would help.
Thank you. Yeah, thanks for that feedback. Okay.
Yeah, and just a comment. So a lot of the other advisory committees, I think, will just be having one meeting. So I'm forwarding the materials to them ahead of time, and then they plan to probably have the discussion and make recommendations during their regular meeting. But given the size of the group of applicants, I didn't want to just go ahead and send all of that material to you without prepping you. So I was hoping to kind of describe the process to you today and then answer any questions. And then after the meeting, with that in mind, hoping to check your availability after the meeting for a follow-up meeting in about a month before the board meeting. And then once you were aware of kind of what the situation was, then to go ahead and send the materials to you. So.
Right. Okay. Thank you. Are there any other
So
criteria?
I have a question.
Oh, go ahead.
I have a question related to terms.
Mhm.
The terms run from July 1, don't they, to June 30th?
Yes, I believe that's right.
Yeah, so I will be glad to withdraw from the advisory committee.
Because you've already passed your term.
Yes.
Okay.
And mine would be up, I mean, it's 8 years, so it would be in the same position. I have one comment about criteria at this point. if there are criteria added on which we rate folks, somehow it seems like people ought to know those other than the requirements specified in the document that you read, David. And the reason I say that, it just seems to me if they're applying for it, it makes sense to know what the criteria are, if there are criteria beyond the required ones.
Sure.
So since the deadline has passed for people to apply, would it make sense once we establish criterion to contact them and say, thank you for your application. We will be making a decision based on these criterion. Do you think that's the right thing to do?
I don't think that's the right order. And I don't know that it would make any difference at that point to them if they're already established. It's like,
Yeah.
I think it would say to someone, why didn't I know this before I applied?
Right. And the deadline's already passed for
Yeah,
applying.
so it becomes a bit moot, I think, but
Okay.
I think the principle is what's important. And, if you're going to, it almost seems like if there are requirements, and I get the idea about diversity and those kinds of balance or whatever factors, geographic and professional, but if it goes beyond that in terms of professionalism or whatever, I think it doesn't have a very good feel for me if I were rating them.
Can you say more about that?
Well, I just think if there are things that they would have known that they could have written about in the letter that they might very well have whatever the criteria are, and I don't know what those would be, that they could have addressed those and made a case for themselves, as opposed to having maybe had a bland kind of letter and because they met the requirements, they submitted that. So that's my point. I think it's, anyway, it's just an observation. I don't think it would make any difference at this point because the deadline's passed.
Right.
And I don't think sending a letter saying that here are the additional criteria on which we're rating folks
Doesn't seem relevant.
doesn't make any sense to me either.
Sure, and I guess I can speak to that just briefly. So in the board governance document, the only three things that are mentioned there is that the committee should work to ensure there's representation based on geographical distribution across the state, which would be something that would likely already be established, based on where that individual lives or where they're practicing. Gender, which, it's kind of in the same category, and then public versus private settings, which is probably something that has to do, with their employment and the types of position. So at least as far as what the board governance document talks about for these factors, those really, someone could talk towards one of those things more specifically, but a lot of that should just be something that could be told by looking at the resume or the cover letter. Now, in terms of how other things are factored in besides what the board governance document talked about, I think that would just be up to you as advisory committees to have that discussion and weigh, how you want to weigh things on an individual basis. But at least as far as what the board governance document talks about, those factors here, to me, don't appear to be things that, they appear to be things that objectively you could pick up from reading the resume or the cover letter. But I just wanted to kind of throw those out.
Wasn't that also in the email you sent?
So I did send a message to individuals, but it just broadly talked about the role of the advisory committee members.
Sorry, I was thinking of psychology.
Yeah, like I said, some of the other advisory committees did have discussions about other things ahead of time that they might want to have factored in the discussion. And they asked me to kind of have a modified letter to include some of that language in the letter that went out to the individuals to see if they'd be interested in serving on the committees. But the message that I sent to the professional counselors was really more of the basic one that just talked about the general role of the advisory committee.
So Ken, it sounds like what you're recommending is in the future to make sure that when that information goes out to have as
Well, I
many.
think so. And maybe though, if what's in that document, that's what you use, there may be discussions about people. I just think, yeah. So I don't know that anything else needs to be done. I think the criteria are what David said, and then the group discusses based on that, and, you know, to get balance and all that, that would take care of it. So I don't think a more detailed rubric would be needed.
Okay.
To do that. I do think diversity should be added to that. I mean, you mentioned gender, and I think that given that that was 10 years ago, that seems to me it probably would be good to update that. But either way, it's still an important criterion on which to rate folks. If you know that, I mean, they may not know it if you don't know someone.
Right.
Hey,
So we'll
that
have,
kind of, I'm sorry, Laura, what Ken said kind of leads into the question I had. I mean, do members of the committee know people that have applied for this or shown an interest? I mean, has anybody talked to you about it?
not me.
Okay. I only know one person from Hayes. She's in private practice, and she asked me about applying, and I said, absolutely, I'd do that because, you know, I'm going to go off one of these days, and we got to make sure Western Kansas is represented,
Right.
which is my big thing. So anyway, all right, I was just curious.
Yeah. So we will receive all 16 applications and we'll be able to review them and then discuss them at the meeting that David will arrange for us.
Yeah, we asked individuals to submit a resume and letter of interest. Some individuals submitted resumes, some submitted more CVs. So there could be a difference between that, but otherwise it should be the 2 documents from each individual who applied. So after the meeting, yeah, I could go ahead and send those out to each of you so you can review those for future considerations.
Right. Thank you. And as far as anybody rolling off right away because your term has obviously expired, I respectfully request that we keep our committee together until we have new members, because if everybody rolls off, it will be Bob, Leslie, and I. And I don't even know if that's enough people to make good decisions. You know, I'd love to have more people. So can we please stick together until we have new people? That is my request.
He has one more year.
Who has one more year?
Kenton.
Kenton. So we got Kenton for a year. Okay, so it would be Kenton, Bob, Leslie, and me.
I was trying to figure out if I should be offended by that. Saying we can't make good decisions. Like, wait.
Wait a minute.
Yeah, but I agree. I think that's great if you know, we can remain intact, obviously.
Yeah, we need, we need as many people to go through this process together as possible.
You need continuity.
Thank you. That's what I meant.
For any group to work well, you have to have, that is
Absolutely.
ongoing. You need to have continuity. So
Absolutely.
that's essential.
Well, and the governance document does talk to the value of having staggered lengths of service. So there is encouragement of that.
So in my brain, we add a good number now and then maybe keep adding a couple every year as people roll off. And that every board I've ever been on has done it that way, and it just makes sense. So we can now start that process. Great. So any other questions right now about adding members?
I think given my new role, I think I should probably be removed from the reviewing of the resumes and cover letters and the information for the committees that I'm on. Not sure.
Okay.
I haven't really thought about that, but it seems like that's the right thing to do.
Yeah.
So I'll probably, if that's okay with this committee, I would probably recuse myself from looking over the documents and making any comments on this committee for that. Seems more fair to me.
That makes sense to me also. So after we
Thank you.
meet, I'll meet with you and tell you what we decided and cover it with you then. Okay. Anybody else? Okay, so our next agenda item,
Actually,
multi-state.
Laura,
Oh,
sorry, one little note. I did mention it would be best for you guys to meet again before the next board meeting, so that way you could make recommendations, and then Leslie, as board chair, could have the opportunity to seek input prior to receiving your recommendations. So just wanted to let you know my plan is that after the meeting today, it could be maybe tomorrow, I'll send out a doodle poll to each of you in an email just to check your availability for a meeting sometime at the beginning of September. The next board meeting is on September 13th. That'll just be a regular board meeting. So I'll just send something out to you guys after the meeting just to go ahead and respond to that poll and note your availability for a meeting.
thank you. How long do you think that meeting needs to be?
Kind of just depends on your discussions of the applicants. I mean, that's if you just wanted to have a follow-up meeting just for that purpose, then it just could be limited to that. So it could be just as long as however that might take you for the committee. So.
Okay. So in my brain, 90 minutes.
Yeah, I think so. Maybe an hour or 90 minutes, just whatever you think would be sufficient to talk about or to make recommendations of those applicants.
Okay. Let's plan 90 minutes, and then if we end early, we end early. Okay. And thank you in advance, everyone, for attending that meeting. It's going to be important, so thank you. Okay, the next item for discussion, the compact, multi-state compact. We don't have any new information about the compact. This is really an opportunity to learn more and to see if anybody else, if you've given any thought to the compact, any new questions, any new discussion items. So David, would you talk about the Maryland legislative website?
Sure. Yeah, so after the last meeting of the advisory committee, I did reach out to representatives from the Council of State Governments, or CSG, because they had a hand in some of the language for the professional counseling multi-state compact. I did try several times to reach a contact with that office, but I wasn't successful in getting that conversation going. So Kylie Dotson Blake had talked with us last time concerning their support for the compact. And I went ahead and went off what she was talking about, that 2 states had passed the compact, and that was Georgia and Maryland. So I went ahead and made some phone calls and sent some emails and tried to reach out to representatives from those states through their legislature, and tried to find if I could find more information on perhaps testimony that had been provided on those bills or information about the actual bill hearings themselves. And I did get a pretty good response back from Maryland's legislature, and spoke to someone. The version of the bill that passed in Maryland was Senate Bill 571. And I provided a document to you in the meeting materials, which is, this is also House Bill 736. So in Maryland, there was a House version and a Senate version of the bill. And to my understanding, they both passed. But basically this document that I provided to you talks about the fiscal and policy considerations of the licensed professional counselor multi-state compact. I thought there was some really good information in here concerning the analysis of the compact and also the fiscal effect it might have on the state, and just kind of summarizing how this compact came about. So I included that for your review. I also talked to someone from the Maryland legislature, and I'll show you a couple of websites that were very helpful as I was navigating some of these that you might want to explore as time allows. So I'll go ahead and share my screen. So this, what I'm showing you on the screen now, is a link to the bill. This is the Maryland General Assembly Compact, this is the Maryland General Assembly website. And this is the Senate Bill 571 that became Chapter 135 of the statutes. This website does indicate as it moved through the process to becoming law, and then it was ultimately signed by the governor. On this website, you can access a lot of information. If you click on the icon here, it will pull up the actual hearing for the bill. And it'll actually go to the time at the meeting where the hearing took place and the discussions took place. And then if you click on the bill itself, it will take you to a page with lots and lots of testimony. If there were only about 3 or 4 pieces, I would have just copied it and sent it to you, but there's a lot more than that. So I have not had a chance to go ahead and explore all this information, but I thought I would just provide you as a committee with more resources so that if anyone wanted to explore this information and kind of see what the discussion was like in Maryland on their compact, that it might be helpful for you to take a look at. And just as a reminder too, the multi-state compact concerning professional counseling is not something that I have been approached yet in terms of asking that Kansas support a multi-state compact like this. All the discussions of the advisory committee to this point have been preliminary background research to prepare ourselves in case we are approached by someone in support of the compact, just so you can be knowledgeable about what's going on in different states and then the background of how it might affect Kansas. So don't have any other updates in terms otherwise aside from that, but I thought I would go ahead and present these good resources from Maryland for your consideration and review.
Thank you. Does anybody have any questions about this? Okay. So moving on to old business, retention of records upon death. We don't have any new news about this. We're going to cover this at our offsite retreat, but this is an opportunity for anybody to bring any new ideas or additional feedback from our last discussion forward. Does anybody have anything they want to add to what we've discussed so far? Okay. Same thing about continuing ed for diversity, equity, and inclusion. Anybody have any new feedback ideas from our previous discussion? Okay. And any new business, any new things?
I do have a question. Have other committees talked about the continuing education requirements for diversity? And what is their, if so, what is their, what's their feelings toward that?
Laura, would you like me to speak to that topic?
Yes.
Okay. So I believe each of the different advisory committees has discussed that topic. Some of them have come out with a recommendation in support of making a modification. Just as a reminder, any changes to that would have to go in through statute because the continuing education requirements are in statute. So it would require a bill to be passed to change the law. One of the ideas that has been discussed would be right now there are 3 hours of ethics and 6 hours of diagnosis and treatment that are required for most of the professions. One option would be to decrease the diagnosis and treatment number from 6 to 3, and then to require the 3 hours in diversity, equity, and inclusion. Other advisory committees may not have made an official recommendation, but have noted support for that with some concerns. Some of the concerns might be that you want to provide flexibility for practitioners to do continuing education classes that may be directed in their area of practice. And there might be other groups that would want similarly specific items to be required. And so if you start making modifications to require continuing education hours and diversity, equity, and inclusion, might there be other groups that would also want certain hours required? And then at a certain point, you have very little flexibility because there are so many other requirements as far as what you must have. So that has been something that has been discussed. The idea has also been talked about in terms of should you allow for potentially, double counting, where currently what the BSRB does when we go through and look at continuing education hours is we don't allow things to count for different categories. So for example, if you have 3 hours of ethics, we will set those 3 hours into the ethics category and then look elsewhere through your hours to see if you have the diagnosis and treatment hours are required. one option would be to, ask that the BSRB change and potentially look at requiring diversity, equity, and inclusion. But if it was diversity, equity, and inclusion, that might also involve ethics. Potentially, you could use the same 3 hours to count for both. So that is something that has been discussed as a way to possibly not tie down too many hours to specific categories. So that's another option. But I would say in general, there has been support for this. There's just some other factors. And so that's why I think there's kind of been a little bit of a split. I think about 3 of the advisory committees had a specific recommendation to do it. 3 others noted support, but also had concerns and wanted to go ahead and have a more in-depth discussion at the offsite meeting of the retreat. So that's kind of where it falls right now.
I have a question, David. Does social work still require safety training?
Yes. So I talked with Leslie about that to see if there were any other differences. And social work does require the safety training, and that's a one-time training. So you don't have to do that every period of getting your continuing education hours. But I believe that's the only unique requirement between the professions aside from the ethics and diagnosis and treatment.
Thank you.
Sounds to me like we can really come out with an opinion about what we want to do at our October meeting after we've had our board's off-site meeting. That seem fair? Any feedback?
Are we working toward making a decision as a whole, as the board, on the September meeting? Dave, has that been discussed? We wanted to finalize this, or are we just discussing it on our offsite meeting?
Well, so, and I say this just from feedback because I have not attended one of these in the past, but it's been my impression that that's kind of the meeting where a lot of the decisions are made in terms of things going forward. So I think it is likely that a decision could be made at that board meeting. So this might be, an opportunity for the advisory committee members to add additional comments for the discussion prior to that meeting. So if you wanted to throw out some additional ideas or thoughts today, that might be helpful.
Okay.
I just remember from, I came on board last year in the middle of November, and I know that there were a few items that were finalized by the board after I arrived, but I think a lot of them had already been put in place. So I think maybe the thought would be that at this board member retreat or offsite meeting, a lot of those decisions would be made at that meeting. So kind of what I've been hearing.
So it sounds like today our decision would really be more, do we want to lean toward recommending a shift in the hours or the conveying support for this kind of training?
Yeah, if you wanted to have an official position or a recommendation, you could bring back to the board for that September 13th regular board meeting, or to have a more in-depth position for the board member offsite meeting on the 27th. So today would be a good opportunity to go ahead and have that and kind of finalize a position as your advisory committee.
Okay. Well, now we know how we can spend the rest of our time.
Could you refresh my memory? What did this committee decide last time when we discussed it? I'm sorry, I've got so many different things to try and remember. Is there a way to refresh our memory on?
We really didn't decide anything. We just named that this was the thing to be thinking about and that we knew it was going to be discussed at the offsite meeting.
Okay, thank you. I know we got some really good ideas and thoughts, but I couldn't remember if we decided on something. So thank you.
I'm not sure that we decided on anything, but I think that the things that David, the ideas that David put forward just earlier were things that we had discussed as well, that we're not opposed to it. Great idea. Problem is some of the drawbacks to it would be how that encumbers the hours for every LPC or LCPC, and that we needed some ways to find some flexibility to be able to do that But otherwise that we were in support of it in general. That's kind of the feel that I had from our discussion.
Yeah, I went back and just pulled the minutes. So at the last meeting, there was just a comment that there was going to be further discussion by the board at its next board meeting in July. I went back to the meeting before that, back in May. And at that meeting, there was a little bit more of a discussion by the advisory committee. And I had down in here that Gary had moved to require 3 hours of continuing education in diversity, equity, and inclusion as part of the 30-hour continuing education requirements, and to replace 3 hours of continuing education in diagnosis and treatment of mental disorders. So that's what I had down for that May 3rd meeting.
Great, I'm glad that was done.
So is there anything else we need to do at this point?
I'm wondering, is anyone opposed to using the same hours to count for both? I think that would be the only other option there.
I'm not opposed at all. I like that idea. Anyone else?
Well, it wouldn't change the total hours any. I mean, it's still required to have the 30 hours. So, you know, I don't think it makes a difference. And I think most people will have them covered anyway, as opposed to using duplicated hours. That might be, it seems to me, it might be an unusual case, although I don't see any problem with it.
Is that a statute level change if we allow them to count for both?
I'm not sure if that would be the regulation or the statute. I would have to look.
Okay. Will you let me know? Are you looking right now?
Yeah.
Well, and while she's doing that, I could go ahead and update you, because it looks like back in the May meeting, there was a discussion on the retention or disposal of practitioner records in case of death of a provider. So we could kind of return to that item if you want to, and I could just kind of refresh the committee's recollection of that item. So for that item, the advisory committee did not make an official recommendation. However, it was noted that the advisory committee members discussed the option of adding a question on the renewal applications to ensure that licensees have a process in place for the custodianship of their records. And the advisory committee members did note their desire to have a process in place for handling the scenario where a practitioner would be the sole custodian of their records and would pass away unexpectedly. But also support for providing guidance to practitioners on this topic. And so the thought on this would be more of a regulatory item where to require that on the renewal applications or the initial applications, we would also want to modify the professional conduct regulations and put a note out to practitioners just to make sure that they were aware this is an expectation, that they have someone in place who would be the custodian of their records. And then you modify that regulation that is one of the professional conduct expectations. And then after you have that in place, then you go ahead and modify the applications to match that.
That sounds like a good process. The changing it in the regulation, what is the process for doing that? Excuse me.
So modifications to the regulations would need to be approved by the board. So if the board could have a discussion on that and then go ahead, and if the board recommended changing that, then we would go about the process of probably writing some regulatory language to add that item to the professional conduct regulations. And then once the board had approved of the language on that topic, then it goes through a process of having that language approved by another agency. and reviewed, and then we would have a time for public hearing. And then after the time for public hearing and public comment, ultimately it would go before the Rules and Regulations Committee by the legislature. And they don't really have the ability to tell us you can't do this. It's more of an opportunity for oversight and to ask us questions. And then after that, then it would go in, and then we can make modifications to the applications.
Thank you. So for this committee, do we need to change anything that we've agreed on as far as what we want to see happen with the professional conduct regulations? We've said that we're going to set that notification would be sent out to say, you need to be thinking about this. And then we would eventually make it a regulation so that on the application for licensure, they have to state that they do have a plan for records. So do we have any more discussion, or we've agreed that this is the right process to take as far as I understand? Is that correct?
Yeah, from the minutes, there was support from the committee.
Yeah.
There wasn't a specific vote or, but there was discussion and there was general support for these items to be done. So it wasn't a specific recommendation by the advisory committee, but based on the discussion of the members, there was support for those items.
So do we need to formalize that process by formalizing the language and then voting on it?
You could do that. You could either have an official recommendation by your advisory committee, or that is one of the topics to be discussed in more detail at the offsite meeting or the board retreat. And so you could come into that meeting and either just discuss that in general, the advisory committee was supportive of these ideas or these changes without it being an official recommendation. So you could do either option.
Okay. Does anybody feel strongly either way? I'm fine with general recommendations. I think we all know what we want to see. Any feedback about that? Okay, then I will move forward at the board meeting, and Leslie, of course, is there also. She's witnessing what we're talking about, so she'll know, but we will, I feel strongly about knowing how to represent this, and the right language, we'll make sure the right language is developed at the retreat or the subsequent board meeting. Anything else about that? Okay,
I have the answer to your question.
what do you got?
So in statute, it refers to 3 hours of ethics and 6 hours of diagnosis and treatment.
Okay,
And in the regulation, it says you have to have those 2 items. The only thing the regulation says is that you can't use the duplicate course in the same 2-year period. So it doesn't really say either way, except that you have to have the 3 and 6 hours.
okay, okay. So it sounds like it would be possible to use DEI course or training and use it in double. Is that?
So there's, and Leslie, correct me if I'm wrong, I don't believe that there's clear statutory language that says, or regulatory language that says it has to be that way. But given that it's been a BSRB tradition to do that, has kind of been the way that we've done things, we would probably look to the board just for a direction on that topic.
Okay.
to change what we have been doing. Is that kind of?
I think probably it should go in the regulation.
Okay.
If we're gonna allow it to change, to be different, I think it should be clear in the regulation so people know what they're doing.
Okay. So again, at the offsite retreat, that'll be something that we can deepen the language about.
Yeah, that could be something for discussion and then consideration if the board wanted to go ahead and allow that. And we would probably ask for just clarification on, would that be limited to this topic, or would it be expanded to, the requirements for hours in general, such as would people be able to count the ethics and diagnosis and treatment under the same hours too, or is this just attached to the diversity, equity, and inclusion if that's added?
I
would
see,
it
right.
be able to double counted? So just to clarify those things, because I can see those questions coming up in the future.
Okay, great,
And not make it too convoluted
right.
So if
for the
I,
licensee and the staff.
so if I wanted to offer a 3-hour course on diagnostic and ethical issues related to ethnicity, then that could count, 1 3-hour course could count in all 3 areas then.
I think that's the question that needs to be answered.
Mhm.
But that is sort of the question. If the board would like us to allow that, or if it should be separate for each, or if the double counting would be limited to just certain requirements.
Yeah, that's a great question. It's very important to define that. So I will make sure that we bring that up at our offsite retreat. Any other feedback or questions to consider? Okay. So it looks like it's time for adjournment. Am I missing anything? We worked fast today. Anything else, anybody?
I would like to bring something up. Leslie had sent me the things about Ottawa University
Mm-hmm.
to look over. And I looked those over and I haven't done a deep dive into their syllabi. But if somebody else would like to look it over as well, I would appreciate that. Just to make sure that I don't miss anything. I do know that they said in there that they are accepted in Arizona for licensure. They're graduates, and I had a clinical supervisee that got licensed in Arizona, and it was a process. So if they're accepted there, I think we should be okay, but I would still like somebody else to look them over if they don't mind.
Okay. Do you have any volunteers for that?
Let's see. I'd be willing to do it, not right away though. I mean, it'll be probably in a couple of weeks.
Thank you for that. So
And
Ken,
actually, I would be willing to do that as well. So at least a couple of us.
right.
I just wanted to make, just to make this clear so that you understand the different processes. Because Ottawa is applying to become an approved program and it's not related to any applicant, that's why it's allowed to be done by the committee.
Right.
And then applicants, when they apply and their program is reviewed, it has to be done by a specialist outside the committee and that's contracted with the board. Just because there's been so much change, I just wanted to be sure, make that clear.
Thank you. I was unmuting because I was wondering what we were doing there. So yes, thank you. Whew.
I will note one thing for Ken and Bob that and all of their, and I don't know that this is a problem, but a lot of their classes are coded as psych and not COUN or something like that. And I just know that, you know, we had at Fort Hays, we had a research class because we're in advanced education program department and it was AEP and not COUN. And in Oklahoma, they would not accept that because it wasn't COUN, even though it was the same information. Now, I don't know if that's an issue or not, but I was just going to throw that out there. And it looked to me like also a lot of their core faculty were doctors of psychology, PsyDs, you know. So, and I don't know that that, you know, is a problem either. According to the syllabi, it looked like they were covering, from what I was able to get through, like they were covering everything they need to cover. So anyway, just some information for you.
Thank you.
So do you want me to send it to both Bob and
Ken?
Ken?
Yeah, absolutely.
Okay.
Thank you guys for helping Kenton. So anything else? Okay, if I need a motion to adjourn.
So moved.
Need a
I
second?
so move.
Okay. So Ken moves, Elaine seconds. All in favor, say aye.
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 Any opposed? I don't see any opposition. Thank you, everyone, for all your hard work.
Thank you.
Thank
Thank
you.
Take care.
Thank you.
See y'all.